My name is Dr. Ian Storch. I'm a board-certified gastroenterologist and osteopathic physician, and you are listening to DO or Do Not. If you're interested in joining our team or have suggestions or comments, please contact us at doordonotpodcast.com. Share our link with your friends and like us on Apple Podcasts, Facebook, Twitter, and Instagram. We hope you enjoy this episode.
My name is Lily Weinstein, and I am a fourth-year undergraduate student at Binghamton University who will be applying to Osteopathic School this year, and you are listening to DO or Do Not. In today's episode, we are joined by Dr. Jordan Keys, a family practice physician who specializes in osteopathic manipulative medicine. In this episode, Dr. Keys describes osteopathic manipulative medicine, what types of medical problems can be treated with OMM, and how these manual techniques make osteopathy distinct. Dr. Keys will discuss growing up in a small town in California and why she eventually moved to New York for her medical training. She will discuss how she became interested in OMM and why she chose family medicine instead of going directly into a neuromuscular medicine fellowship. I know you will find Dr. Keys' journey as inspiring as I did. We hope you enjoyed this episode.
All right, Jordan. Thank you so much for being with us tonight.
Of course. Thank you for having me.
Okay, so usually I have a very linear path in the questions. I'm going to go a little different tonight because I have some very specific questions for you. So can you start for our listeners telling us a little bit about what OMM is, what osteopathic manipulation is?
Absolutely. So we sort of use a couple of terms interchangeably in the osteopathic world. So we use the term osteopathic manipulative medicine and osteopathic manipulative treatment. And those are a little different, and I'll distinguish those as I talk more about it. But this is in many ways, I think, the hallmark of what, from an educational perspective, really distinguishes sort of the allopathic educational model and the osteopathic educational model, with addition of some of the tenets, which I'm sure we'll get into at some point. But this is really the educational difference. And so when we consider osteopathic manipulative medicine, we're really referring to the hands-on portion of the curriculum that the osteopathic medical student learns. So this starts week 1 of classes, and this is when the student learns to use their finger pads. We say palpate, right? Use their finger pads to feel their partner or future patient's musculoskeletal system and make specific diagnoses based off of restrictions of motion or increased tension or asymmetries of the tissues. And so this diagnostic process we call it the somatic dysfunction. And we use different techniques to treat these somatic dysfunctions. And so when I use the term osteopathic manipulative treatment, I'm really referring to those specific techniques that we learn to treat these different somatic dysfunctions or these asymmetries in the tissues that we feel. And when I use the term osteopathic manipulative medicine, I'm really referring to the application of these treatments to the patient that's in my care. So that's really the two definitions that we use often pretty interchangeably within the profession.
Yeah, so that's great. And I think I mentioned to you earlier, I was recently on actually 2 different podcasts where they were asking me a lot of questions. That was one of them, and I couldn't really give a great answer. My other question that, as I was kind of speaking about this, is there used to be a term called OPP, Osteopathic Principles in Practice. Does that still exist?
It does. And so that's the other term that sort of gets thrown around with OMT and OMM. So osteopathic principles and practices is really the application. It's the overarching philosophy of osteopathic medicine and its application to the healthcare system. So it's a larger term of really applying not only the osteopathic manipulative medicine, but also the other tenets of the philosophy. So our tenets are really, body is mind, body, or we are mind, body, spirit, structure and function are interrelated, and that the body has self-healing, self-regulating mechanisms, and that rational care is dependent upon these tenets. And so OPP is really the overarching philosophy of our approach to patients.
So I'm just going to ask you a question about that also. And obviously, I'm a proud osteopathic physician, so I sort of drink the Kool-Aid, and I agree with what you're saying. But I recently was talking to an MD on his podcast, and he sort of made an argument that all physicians, including MDs, agree with osteopathic tenets. How would you respond to that?
I actually agree with that. And I often, I get this question a fair amount, and I often tell the students, I really believe that most allopathic physicians also believe in those tenets. I do not think that they're only osteopathic tenets. I will say, I do think they're woven in a little bit more deeply in the curriculum at an osteopathic medical school. And so the students from day one are really naming those tenets and thinking about those when they're thinking about patient care, even if they're not specifically doing OMT. So I do think they're woven in a little bit deeper. And because of the primary care model that a lot of our physicians go into, obviously not all of them, many specialized, as yourself has specialized, but many go into primary care. And in primary care, those tenets, I think, weigh out a little bit heavier. And a lot of allopathic programs are much more specialized in their care. So it's not that they don't exist in the allopathic community. I just think they're often woven in a little bit deeper in the curriculum and the training in the osteopathic profession, in my experience.
I think that's a great answer. And that's basically what I said. So you make me feel. So can you tell us what type of medical problems specifically you would think of treating with OMT?
I get this. I do a lot of presentations for our admissions department, and the students that are looking to go to either an allopathic or osteopathic, they often ask that question. And I tell them, really, what can I not approach with OMT? What can I not use that, right? Am I going to specifically treat someone who's having an acute episode of something at the moment they're having the acute episode with OMT? Potentially not, right? But it still gives me a diagnostic tool that I might not have had otherwise. But if I just think about, even just yesterday, I had an afternoon of patient care. I saw everything from a 15-year-old who has a labral tear and scoliosis, to a 14-year-old who's having some anxiety and depression, to a 1-month-old who's having some problems with feeding and latch. And then I saw, a Parkinson's patient. I saw a patient with Ehlers-Danlos syndrome. I saw a patient with migraine headaches. I saw a patient with low back pain. I actually had a patient who normally comes to me for a TMJ, but was having a bronchitis episode, so I treated her. So the structure-function relationship actually is pretty broad in that it scans many different types of disease processes. At the end of the day, I'm an anatomist and a physiologist. And so that's always what I'm looking at with my patients when they come in. I'm looking at what type of anatomic and physiologic changes are they having in response to whatever condition they're presenting with. And so that's really my approach. I see patients with all different types of conditions.
So my follow-up question, there are other practitioners that do manual therapy, such as a physical therapist or maybe a chiropractor. So can you give us sort of an idea of why an osteopathic physician that's using manual therapy, what makes them different, or what makes the therapies different than something that, say, a physical therapist or a chiropractor would do?
Again, great question. I think there's a couple key points here. One, I work with incredible physical therapists that do incredible work, and I've worked alongside incredible chiropractors. So I'm never wanting to dismiss either one of those professions because I think they do great work. I will say one of the big differences is the level of training, right? So as a physician, you really get the level of training from a complete perspective. So you get anatomy, physiology. I know all the micro, I know the pharmacology. I've done residency. I've really done the medicine. So my training is just much more extensive. So when I approach the musculoskeletal system, it's with that knowledge, right? My fingers and my mind have that knowledge behind it. So that's one of the key things. It's just the level of training that we have. We also have a fairly different approach, specifically with regards to chiropractors. So chiropractors, actually, the profession stemmed off of osteopathic medicine. The initial chiropractors chose not to learn the breadth of medicine that the osteopathic physicians were learning. And so a lot of their practices have turned into some of the quicker procedures that we think of with chiropractors, sort of the cracking and popping, which as an osteopathic physician, I'm trained in, but is typically not my mainstay because my mainstay is really looking more at the different tissues that I'm trying to treat and really digging into my knowledge of anatomy and physiology for that patient. And the other key thing is when we think about the concept of diagnosis and treatment, So one of the reasons why we call it osteopathic manipulative treatment is we have to make a diagnosis in order to treat, whereas most therapists, both physical and occupational therapists, actually don't do the diagnostic process. They do more of the therapy process. So it's just a different approach to the patient.
Yeah, that's perfect. I recently did an interview with PM&R, a DO, and he was saying exactly as you said, that physical therapists, he would write a prescription for a specific therapy, and then they are excellent, but they would execute on his prescription.
Exactly. Yeah, the diagnostic process. And that's changing a bit as more of our PTs are doctorate, right? They have a little bit different level of clinical acumen, but that still is sort of the way that we do physical therapy versus being a physician.
So on the physician topic, a lot of times as physicians, there's a lot of emphasis on science and evidence-based medicine, right? That's sort of a catchword that we all talk about. So sometimes when people talk about complementary therapies, they say that complementary therapies, a critique is that there's not as much evidence. So when people ask you about OMT and evidence-based OMT and maybe lack thereof, how do you address that as a question?
So I first acknowledge that I do think it's a problem, right? I do think it's a problem that we have not done more rigorous evidence-based research with osteopathic manipulative treatments. And I think that we are in the process right now of starting to address that. And I can go into that a little bit more. So I do acknowledge that I do think it's an issue. I think evidence-based medicine is much more difficult to do with procedures than it is to do with medications, right? So I think that it's a little bit different beast than studying straight medications, which a lot of our evidence-based medicine is. And there's also a lot of funding issues around it. So I do think it's an issue. I will say, I don't think it's an issue from a patient care perspective for me. I do see, I have a few month wait list, right? Like there's definitely a desire to see people who do OMT. However, I do think as a profession, it's our opportunity right now to say, okay, this is the opportunity for us to now do some better, high quality, more evidence-based research. And I think that some institutions are really taking that on. I know us at NYTCOM are in the process of, I do a collaborative project with my basic science department where we're doing actually rodent-based OMM research. So we're able to do a lot more than you can do in a clinical setting. And yes, the answer to your question is we are doing OMM on rats. That's what everyone first thinks. I actually did that today. And then the other big exciting project is we are in the process of getting an MRI machine that has functional MRI capacity. So we'll be able to use that as well for research. So I acknowledge that I think it's a problem, but I think it's a problem that there's a lot of us that are really ready to kind of jump into and really show that what we do is effective. And now we have the tools that we can actually show from an objective perspective.
My next question is, if someone was looking for a practitioner that does manipulative medicine, and should they be looking for someone that's certified in OMM or a practitioner that uses OMM? Would you give them advice on how to seek out a practitioner?
That's a great question. And there's a couple of websites that I tend to steer people towards. I don't think that it's absolutely necessary for somebody to be certified in neuromuscular skeletal medicine, which is the board certification for OMM. I do think it's helpful because it means that that person has an extra layer of training. However, I will say there's not a ton of us out there. So it just limits the amount of practitioners that are available for people. However, there's a lot of DOs that do not practice OMM, right? So you don't want to just go onto the AOA website and find a DO in your neighborhood, and it turns out they don't do anything, right? All right, they don't do OMM, right? And so you're in the wrong spot. And so typically physicians that are registered either on the Osteopathic Cranial Academy website or the American Academy of Osteopathy website, those two websites, most of the physicians you're going to find there are going to be physicians that practice OMM. The other thing now in the age of the digital world, you can look on the internet and most people on their website will say if they do OMM or not. So you're really looking for somebody who names it. Just because they're a DO does not mean they practice OMM.
A little off topic, but before we go into your story, I know you've been at multiple comms, College of Osteopathic Medicine, and a lot of our listeners are pre-medical students that are looking at the different colleges and trying to decide where to go. So can you take a few minutes just to tell us which comms you've been present for a significant amount of time and both from like a city perspective and a school perspective, what you see their strengths as.
Sure. So I am a graduate of NICOM, and now I am a faculty at NYTCOM. I taught adjunct faculty at Touro College of Osteopathic Medicine in Harlem. I was at the Lake Erie College of Osteopathic Medicine, their Bradenton campus, for a couple years where I helped with the OMM curriculum. And then I most recently, before coming back to New York, was at Touro College of Osteopathic Medicine in California, where I was in the OMM department. And so all of them obviously have strengths and weaknesses. I think one of the biggest strengths we have going here at NYTCOM is that we've just got such a large alumni base in the region. And so there's very few hospitals you're going to go to where you're not going to run into somebody who graduated from NYTCOM or previously known as NICOM. So I think that's one of the biggest strengths. I also think one of the biggest strengths we have is we have a group of osteopathic physicians that practice OMM in the clinic. And so when you have physicians that are actually in it doing OMM, it gives a mentorship model for people who are interested in doing OMM. So for instance, every clinic session this summer, I at least have 2 or 3 students with me shadowing, or I don't actually have them shadow, they help me, right? Because they are now second year students and they have some skills. So there's a lot of us that are doing it. So we're able to show them what a practice using OMM looks like. I will say that is the number one thing that I think creates a culture of students being interested in OMM. I think when I was in Florida, and I think this has changed now, I know that they've developed a clinic there, but when I was there, we didn't have an active clinic. And so the students weren't really able to see us practice. And I think that didn't give them the lens of how OMM can be used in a clinical setting. So I think that sort of diminished their experience of OMM, even though they were getting quality education in the classroom. It's hard to then not see it in practice. When I was in California, we also had a pretty robust department that everybody was in practice. And so the students had the opportunity to see it in practice. And so I think that that was a real strength there as well, is just being able to see faculty that are actively using OMM in a clinical setting. So I think that's the number one thing that really creates that culture of students that are interested in pursuing OMM.
So you told us about it, your day and what patients you saw, but in an academic setting doing OMM, can you just give us an idea of what your week looks like? And for example, like what time you wake up in the morning, what time you get to work, and what days are clinical days, what days are teaching days, and kind of give us an idea of what you do on a weekly basis.
The beauty of academics is there's so much variation, right? And the beauty of academics in, I don't want to say post-COVID times, because I think we'll always be sort of in COVID times, but in the time where now remote work is much more of a thing, we also are in a very different space. We're in a very different space from a job perspective. And so each day of mine actually looks a little bit different. So Mondays are my clinical days. And so I actually start a little bit later in the clinic. So I usually get into the office around 10 or so, and I start seeing patients. And so I see patients all day on Mondays. And then Tuesdays are typically my research days. So Tuesdays, depending upon what's going on with research, I sometimes will be at home doing research, because a lot of my research I can do from a remote perspective and run meetings from a remote perspective. Or sometimes I go in, like today I went in and I was actually treating the rats and doing different actual research at the actual institution. Wednesdays are typically my teaching days. So Wednesdays I'm in lab all day. So I help teach in the OMM lab all day, which for those of you who have never been in an OMM lab, it means that there's typically a group of about 8 students and pod leader. So I would function as a pod leader, and techniques are demonstrated from the front of the room, and then they're practiced on partners in the pods, and the pod leader helps facilitate that. And then Thursdays, I'm split between clinic in the mornings and then teaching lab in the afternoon. And then Fridays are an administrative day and a research day for me as well. So that's a pretty typical week. It's a real mix of clinic, research, and lab. I'm also the director of the Osteopathic Medicine Center, and we run a lot of CME educational events for local physicians. So I'm also in charge of planning and facilitating a lot of those events. So I use some of my administrative time for that as well.
It sounds varied and very cool.
It's fun.
Right? Yeah, fun.
A really fun job. Really fun.
So Jordan, tell us where you grew up and when you decided you wanted to be a doctor.
So I'm from Lake Tahoe, California, which is a unique place to be from. Not many people are from there. It's a very small, beautiful place to grow up. And unlike many of my colleagues, I did not grow up wanting to be a physician. I'm the only physician in my family. And I lectured to a group of high school students today, and I was telling them I was so impressed with them that they're in this program thinking they're going to be, not thinking, like going towards being physicians. And at their age, I think I wanted to be a fashion designer, right? Like I had no aspirations of being a physician. And then I ended up in college, I ended up taking a chemistry class because the faculty member was supposed to be so incredible. And I realized how much I loved science. And so I felt like in college, there sort of was this push if you're going to go down the science route to go the pre-med route and get the classes that you potentially need for pre-med. And at that point, I had the opportunity to shadow a local surgeon who I had grown up with his daughter and realized how much I really liked medicine. And so that was sort of what sparked the interest for me was actually in college. I did not go directly to medical school. I decided to take a little bit of time in between, mostly because I wanted to do a study abroad program during my fourth year of college. And so it didn't really allow me to have the opportunity to apply for medical school. But that ended up being a really great chance for me to broaden my perspective of what medicine was. So during the 2 years I took in between undergrad and medical school, I had the opportunity to work. I actually did marketing for a nursing home, which was an interesting job and a whole other conversation. But during that time, our medical director was a DO. And so that was really my first exposure to osteopathic medicine. And so even though she didn't use OMM, I just remember thinking, gosh, she is just such an incredible physician. And the way she approached the patients seemed really unique and dynamic to me. And so from that point, I also was really into nutrition and health, and so I actually looked into the naturopathic world and thought, do I want to pursue an ND? And the DO sort of fit really nicely in the middle. It allowed me to pursue a lot of the more holistic and natural approach to medicine, but also gave me all the same opportunities as my allopathic counterparts from a specialty and licensure perspective. So that was really when I decided to pursue becoming an osteopathic physician. And I only applied DO. I didn't apply MD and DO because at that point, I really knew that was my path.
Where did you go to undergraduate college?
I went to a small private school in Santa Barbara called Westmont.
Where did you do your semester abroad? And how was that?
Oh my gosh, incredible. I did a program called Europe Semester. And so it was actually a group of us that were all we were all from Westmont. There were 40 of us and 2 professors. And we traveled through all of Europe. So we went to 22 cities and we stayed in hotels. And the hotels we stayed in, we did classes. So we did all the classes. And so in the morning, you would do a class and you'd learn about if we were in London, we'd learn about the different art we were going to go see that afternoon. Or if we were in, so it was very dependent upon the city we were in. So we traveled Ireland, England, Switzerland, France, Belgium, Germany, Austria, Czech Republic, Italy, and Greece.
Amazing.
Life-changing. Yeah.
Amazing. Yeah. So my question on that is sometimes I see very dedicated students. And I think when I was going to school, it was definitely more popular to get through as fast as you can, so a lot of dedicated students now are looking at 7-year med programs or being locked in, especially as you said, like the high school students that know that they want to be doctors. But there are some people that argue that having range and having life experience adds more even to you as a physician. So what would you advise people, especially based on the fact that you took the 2 years, did something different, and did this European experience?
I think it's made me, I mean, it's hard. It's all right. It's hard to say what makes you a good physician, right? But I would say it's made me much more well-balanced having taken that time. The other thing that it really did for me, I've been in medical education enough. I've seen patterns, and they're patterns, right? They're not every student, but I've seen patterns of students who go directly into medical school, students who do the shortened program, so the 3 years of undergrad and the 4 years of medical school, and students who take a year or two in between. And I feel like the students who go straight in, a lot of times are much more prone to burnout because they've not stopped at all. And they've never had like that moment to pause and to have a job and to get some different life experience. And so I think that for me, it was really helpful. And I've seen a lot of my students who've taken time has been really helpful. It also helps a lot of times when you have an experience outside of education. It helps to sort of clarify what your desires are from a physician perspective, right? Like I think a lot of my students who took maybe a gap year and traveled and maybe did some research, coming back into it, they have a little bit different perspective of what they want to do within the medical profession, and their objectives are much clearer. That being said, I've also had a lot of students who are just gung-ho and want to get through, and they do it beautifully, right? They do it beautifully. I always tell every student, though, who I talk to a lot of high school students, I always tell them, no matter what, get yourself in some clinical setting and see what medicine is like, right? Like don't go through that 7-year program without at least getting in and seeing what a hospital looks like, seeing what a clinic looks like. Get some experience, because it doesn't look like Grey's Anatomy, right? It doesn't look like what you see on TV. So make sure you at least have some experience in a clinical setting that helps you at least recognize if this is actually what you want to do.
That's great advice. I think that's awesome advice. So now we're setting up, you decide you want to do an osteopathic degree. Mm-hmm. You know that, maybe you want to do manipulation. You have this great mentor who ran the nursing home where you worked. So you're in California and you end up in New York. So can you tell us a little bit about the places that you applied, what schools you were considering, and how you ultimately ended up in New York?
Yeah, so I did a pretty broad stroke from the osteopathic schools. And the only two that I got into anytime you apply to medical school, although I think that people apply to far more than I did, right? It's a different time now, but I applied to, I think, 5 or 6 different schools kind of around the country. And the two that I ended up pursuing, though, were California and New York. And the reason why, I was going to go to Western. I was set. I had gotten in. I was going to go to Western. In Los Angeles. My sister lived down there. I knew I was I'm from California. It felt comfortable to me. And I think my mom actually regrets doing this. But my mom said to me, she goes, maybe you should just look other places, right? Like you're not married. You're not in a relationship. Maybe this is your time to go experience somewhere else. And so she said, why don't we fly to New York? Because she had spent some time when she was younger living in New York. She said, why don't we fly to New York? You can interview at NICOM. We'll have a New York weekend, and then you can go from there. So we came out, and we went to Broadway shows, and we did all these really fun things. And I interviewed at NICOM, and I was like, I love this. Of course, medical school didn't look exactly like a lot of Broadway shows, but I was like, oh, this is a great way to live, right? And so she sold me. And so that's when I decided to move to NICOM. It was really out of adventure more than anything. And then I stayed because I met my partner.
And again, you moved around a little bit. We're going to get to that also, right?
Yeah.
Okay.
Yeah.
So you're at NICOM, you're taking classes. Again, you have this idea before you started that you like sort of the complete physician, right? You rotated with a surgeon before you even thought about medical, your friend's father. And did you know right away that you wanted to go into osteopathic manipulative therapy, into neuromuscular medicine? Were there other things you were considering? And then how did you decide on your residency?
Yeah, so I was a little bit scattered in what I wanted to do. One of the things that kind of led me down that path was we have a scholars program at NYTCOM. We called it fellows back there, but we call it scholars now. So students have the opportunity in their second year to apply to do an additional year of medical school. And during that year, you get to teach, you get to do research, and you earn a master's degree. And it was a great year. And so I applied for this scholars year, this fellowship year, and I got it. And mine was specifically with the OMM department. And so during that year, I got to spend a lot of time with the faculty who ironically are my colleagues now. Many of them are still here, which is awesome. And I got to spend a lot of time with them. I got to be mentored by them. I got to work in the clinic with them. And so that was really one of the times that really spurred my interest. I also had a unique experience during my third year. When I was on my surgical rotation, I had a PA who I had gotten pretty close with, and she called me and she said, one of our patients yesterday, she had surgery. She's been laying in bed. She's complaining of neck pain. Can you come over and, do some soft tissue? I know you're an osteopathic medical student. And so, I was like, sure, yeah, I don't really know exactly what I'm doing, but I know enough, right? And so I went over and I started to evaluate her. And as I examined her, because I had spent so much time examining all these normal young students during my preclinical years, I realized her back did not feel normal. It felt hot. It was very tender. And it was really concerning to me because the area that was tender was something that I had learned during my preclinical years was an area that's associated with the heart. And so I went and I told the PA, I said, gosh, this does not feel like a normal back. This does not feel like normal muscle tension, normal tenderness. Does she have a history of cardiac, pulmonary? Like, is there something else I should be concerned about? And she said, I think, she does. She has a cardiac history. And so she called the physician and they did an EKG and she was actually having a heart attack. And so this was another one of those moments where I was like, wow, this thing that I'm learning, this is incredible, right? This is an incredible tool for me. And so I actually chose to pursue, I was between doing family medicine and PM&R because both of those lend really well to OMM. And I chose to do family medicine. And then this, I really thought I also thought about going straight into an OMM residency program, and not that you wouldn't get this at an OMM residency programs because you still have to do an internship, but I really wanted a really solid medical basis to my training. And so I ended up doing a family medicine residency program and then an additional year in neuromuscular skeletal medicine, which is the OMM, right? The extra training and the hands-on. And I did, part of the reason I did that was not, at that point, I probably didn't need a lot more training in the OMM because I had done the fellowship and the family medicine residency, but I knew that if I wanted to go into academics, it can be helpful if I wanted to be a chair of a department or something like that.
So you finish your family practice, you finish your OMM, and then you went into private practice. Is that correct?
So I was going to actually join NICOM at that time, but I just felt like before I went straight into academics, I wanted to get a few years of straight clinical practice under my belt because I learned the most from my patients when I saw them. So then I joined One Medical Group, which is a large primary care practice in the city. And I joined their practice 3 days a week. And I was just at that time doing OMM. So they're very DO friendly. They love OMM. So they hired me to come in and do OMM. So at the time I was also adjunct at Touro. So I got to do a little bit of teaching as well. And so I was there for about a year and a half. And then my husband and I decided that we wanted an adventure because that's a little bit of my personality and he goes along with it. And so we moved to Florida where I joined a faculty at LECOM in Bradenton and spent a couple of years there, which was an adventure and lots of beach time and learned that was great for what it was, but wasn't our forever place. I will say one really fun thing about teaching at LECOM, it was a problem-based learning curriculum. So it was a very different model of teaching. And so I got to learn how to facilitate conversations in a different way, which I think has really grown me as a teacher and as an educator. And then from there, because I'm originally from California, we decided to go spend some time in the Bay Area, which is not too far from my parents. And so I was at Touro in California for a total of 3.5 years. In the last year I was the chair of the OMM department. So that was a really great growing opportunity as well. And I got to learn from a lot of different incredible mentors. And then at the end of the day, I married a New Yorker. So we came back to New York. Full circle.
Right. I had a similar experience. I totally get it. I keep getting dragged back to Long Island. So can't get away.
Right. It just is. I can't complain. It's a pretty great place to live.
We have 2 grand finale questions that I'm going to ask you. The first one is, what do you think is the key to your success as a physician and in your career? And we kind of phrase it as, what would you say is your superpower?
Oh, so just to start with, I think one thing that medical education makes you incredibly good at is being adaptable. Right. I mean, I just think back and it's one of the most frustrating things that our students go through. It's that constantly being in a different rotation or constantly being asked to think differently or be tested differently. So you're constantly having to adapt to different environments. And I think that is something that as I've gone on in life, I've learned is an incredible skill to be able to walk into any environment, whether it's a new job, whether it's a new clinical site, any of these, whether it's a new town, and just to be able to really be adaptable and to get to know your surroundings quickly and to be able to contribute to your surroundings quickly. And with that, I think I'm very much comfortable at being a little bit uncomfortable. Like I like to be pushed. I like to think differently. And I think this is one of the key things that makes me good at being an educator. I love this group of young people because they are so out of the box in the way that they're thinking. And they're willing to push, and it's uncomfortable, but it has changed the way I view the world. So I think that willingness to just be able to adapt to my environment, and that willingness to be a little bit uncomfortable and be willing to change my mind and change the way I view the world has been the key to my success in many aspects of my career thus far.
That's awesome. So our last question is, can you give us one piece of advice that you were given from someone else, that someone else gave to you, one piece of wisdom that was imparted to you that you feel has been influential and that you would like to pass on to our listeners?
Can I give two?
Yes, I'll take two. Okay. We'll take five, whatever you got.
So I'll give you two. So the first one is, don't do anything just for your CV. Don't do it for your resume. Like, I feel like students will be like, what should I do to get a good residency? What should I do? And I say, well, here's these 10 things you could do. Or you could do the things that you are really interested in and pursue that. Because when you do that, you end up in places that you feel comfortable and that align with who you are. So really do things that align with who you are, not just to put on a resume. So I always viewed life like that. And I had actually, it was somebody very early in my career in undergrad who told me that. And I think I've ended up in the place that I want to be in many ways because of that. And the second one that I think, and I tell all my students, is find your person. Like when you get to medical school or wherever you're headed, find that faculty member or that student that's maybe a couple years ahead of you who you connect with, who has a similar path, a shared experience of their career with you that you respect and that you can call and you can hold on to in those hard times. Because there is every person who pursues medicine is going to have a bunch of successes and everybody is going to have a bunch of failures, and both are really challenging in their own ways. And if you have somebody that you can call up and you can just run life by with, that can give you new perspective and can help you, that you need one of those in this profession. So I tell everybody, find your person, find your mentor. And I've been really fortunate in my career to have many of those that I still get to work alongside.
I said we went through our last question, but I have one more question. So okay. I need to reflect a little bit. So when I first decided to go to osteopathic school, I didn't fully understand what OMM was. And I was in college in Binghamton. I went to the library and I found this like wacky old OMM book where people were being put in different positions and having OMM. And that was what I had. And it was not perfect, but it was good enough. And again, I decided obviously to go to osteopathic school. So if there's a student that's listening, let's say a pre-medical student, and they're like listening to you and inspired and thinking, wow, this is great. This might be something that I want to do. And again, they're not even in medical school yet. Where is there a resource? Is there a place that they would recommend? Is there a person you would recommend that they look for? How would they learn more about OMM?
Yeah. So, I mean, obviously in the days of the internet, you can just Google it, right? And so there's resources on YouTube. And I'm going to make a plug for the center website. Not that I get any like kickback, no disclose, like I'm not, don't get any money from this or anything, but I've built a website for the Osteopathic Medicine Center that actually, if you go on to, I've put together a repository of a bunch of videos. So there's a lot of videos on there of OMT, like us performing techniques. And there's also a bunch of videos. We've been creating a video library of us talking about different medical conditions, talking about the osteopathic approach to it, and then demonstrating an exam and techniques. And so it's a great repository of just a bunch of videos. They're also Idaho College of Osteopathic Medicine, I know that on their website, they have a lot of videos too showing OMM used in different conditions. So I think one thing you can do is if you go onto the AACOM website also, and you just find different medical schools, most of the medical schools, if you dig around on their website long enough, you'll be able to find videos of people performing osteopathic manipulative treatment. The other thing you can do, as I said in the beginning, is you can go on the either American Academy of Osteopathy website or the Osteopathic Cranial Academy website and find a DO in your area and reach out to them. Most would love to have you come shadow, right? Reach out to them and actually go get treated. I mean, how many of us have back pain essentially from sitting here on Zoom all day long? Go make an appointment, go get treated, go actually see what it is. That is the best way to understand what OMM is to actually get treated. So, that's my other recommendation is go find somebody.
Jordan, you've been great. Thank you so much for spending time with us tonight.
Thanks, Ian. This has been great.
This concludes our episode of Do or Do Not. Send all inquiries, comments, suggestions, and even let us know if there's someone you want us to interview to doordonotpodcast@gmail.com. Don't forget to like us on Facebook at Do or Do Not Podcast for updates. If you enjoyed our podcast, please share it with your classmates and administration. We have plenty of more interviews lined up, and we're excited to share them with you. This is Tian Yu Shea. Thank you guys so much for listening to Do or Do Not.